The evaluation station is the final summary of the patient's experience in the hospital and or in the community, and how we're going to end the API assessment process. So with the OSCE, they're now asking for in TOC 21, in the new 10 station OSCE, for you to do an SBAR handover. And this station now comprises of you writing down situation, background, assessment and recommendations for the patient. This is meant to be so that we give a brief, concise handover with the information that another health professional would need, because typically handovers can take a long time if too much chatting goes on. So this has been devised and implemented into nursing and other professions to help us to give, like I said, a really concise and meaningful handover. And so I'm just going to explain for this patient how I'm going to do this. I've got a patient here who's in the community. She's a diabetic patient, and she now has to be referred to the diabetic nurse because she has some issues around nutrition and weight loss. So for a diabetic nurse or any specialist nurse to accept the referral, we have to make it so that the nurse can see where we're coming from and why a diabetic specialist should have to see them. This information has to be included. She has got other issues. She's got a mobility issue. She's got pain. These are issues that can be mentioned, but they're not the main focus of what you're talking about. So I've typed one out, but in the OSCE I would be given a blank form, and I'd fill it in as I went, but I've typed it out so that you can read it better this time. I'm just going to explain it as if I was writing it, and I would be given back my assessment paperwork, planning, and also I'd be given back my medications paperwork. But I would also get a scenario, so I'm going to show an example of the scenario paperwork and how that presents, and it's just got, again, a very brief handover about the patient, and then it'll give a set of OBS. So we have to mention that latest set of OBS and any differences maybe that they had from the first set of OBS in assessment. So this is the paperwork as I would complete it if I was writing it. So it's got the patient's details at the top, and the situation includes me introducing myself to start with. And you should always give the recipient of the handover your name and your role. So I am Jodie Robinson, a community nurse. I am handing over Elizabeth Simmons. She's 1st of the 1st, 1960. Hospital number 246810. That's the information I've got. She is suffering with unstable blood sugars and is currently comfortable, but feels dizzy when mobilising. She does require monitoring and education about her blood glucose and monitoring her diet. So you can see how writing it down can make that more concise without talking around the subject, which is not what is required in this. We're just trying to explain to a diabetic nurse her main issues and why they should get involved in her care. Her background. So because the patient had been asked to be called Beth throughout the assessment, we're going to call her Beth and then refer to her as that from now on. She has recently been diagnosed with type 2 diabetes. So she's recently diagnosed, and this would mean that, obviously her management isn't as good, but just as purposes as talking to the diabetic nurse, I just have to mention that she's newly diagnosed and that she was admitted to hospital with unstable blood sugars, dizziness and unsteadiness. She has a history of osteoarthritis, glaucoma, hypertension and a broken arm at 8 years old. She smokes 20 cigarettes a day and she lives alone. Her daughter lives 200 miles away. So these situations, again, can make her situation a little bit more complicated. So having a smoking habit is not ideal for any diabetic. So I'm sure the diabetic nurse would be concerned about that as well, and that we should encourage her to give up smoking, which we did, and she did accept that referral. So like I said, we just only need to tell the diabetic nurse that she smokes 20 a day, and she's agreed to quitting smoking and trying that. She lives alone, but her daughter lives 200 miles away, so she hasn't got any close relatives. So for assessment, we're going to look at Beth's last news score. So we're going to do any results from any recent tests that they've had. So we did her news, and we got given a scenario which had her news score on, and it gave us a news score of 1. We're just going to mention where the 1 came from, and that came from a slightly low blood pressure. Her previous news was 0, so that's also, we could mention that there's been a slight change there, but it's only a very slight low blood pressure. Beth has a pain score of 3 out of 10 as well. So we're just saying, she does suffer from pain. That is part of her presentation and what she is experiencing. And that she uses a walking stick and can only mobilise for short distances, which is relevant because obviously it means she's not going to be able to get a lot of exercise and be healthy in that way. She has erratic eating habits, which basically she's eating food which is very high in sugar. So that would be something I would write down to prompt myself while I'm giving the handover to the nurse. A sugary diet is not what a diabetic nurse would like to see with the patient, so that's something they can work with her on. And also that she has actually been losing weight, and to a point where it affected her BMI. So now her BMI is below normal. So that would be relevant to the diabetic nurse. So she's also lost weight, which she said that she's not tried to lose. It's unplanned weight loss. So that gave her a must score of 2 on assessment, and that paperwork will be given back to you to hand over, so you'll be able to remind yourself if you have any worries about that. Now, recommendations, this is what we may have written in our care plans as well, what we would like to see. So we want to monitor her OBS every 6 hours until they're stable, and we'd also say we'd do their must score weekly and monitor blood sugars pre and post meals, maintaining weekly weighing. So I might just write in about the must score here, must doing that weekly, just to remind myself to hand it over to the nurse, so that you'll be filling this in, not for the examiner, but for yourself, to prompt yourself as what you're going to say in this verbal assessment that you're having. So we want to do her must weekly and monitor blood sugars pre and post meals. This is something you'd expect a diabetic to do to give a good picture of how their blood sugars are. And with her having erratic blood sugars and eating habits, it's something that we'd like to see what the pattern there is. And we've also got maintain weighing weekly. So if somebody was losing weight unplanned and quite a lot of weight like this lady did, we'd like to keep an eye on that and keep a weight chart. Her food diary as well is a good idea. So we can see what she's eating, how much she's eating, and see if we can improve and what sort of food she likes, whether we can build on that with her new diabetic regime, and educate her on the diabetic diet and what's preferable and what type of foods are acceptable and which ones we would consider to be more harmful than good. So we're going to mention the referrals we'll make. So we're referring this patient to the diabetic nurse. We don't really need to write it down because we're speaking to the diabetic nurse, but we've also want to refer her to the dietitian, the smoking cessation team, which she did agree to, and physiotherapy, which she also expressed an interest in seeing a physiotherapist to improve mobility and to see if she has got the right walking aid, and whether they would also note whether she needed occupational therapy if she's struggling at home with her living, whether there are aids and adaptations in the house already, or whether she needs some new fixtures and fittings to help her around the house a bit better. So that's how I would complete the written bit to start with. So just like I said, to prompt myself. This is an oral exam, it's not a written exam. This writing is to help me, prompt me to give the correct handover, and in the order that they've asked us to do that. So that's applies to all the different patients and how we should do that. I hope this has helped you for the evaluation station.